Cyclobenzaprine Hcl Er is a medication used for the short-term treatment of muscle spasms. It is typically used in combination with rest and physical therapy. This medication helps to relax the muscles, providing relief from discomfort. It is important to note that this medication is not recommended for use in older adults, as they may be at greater risk for side effects. It's best to consult with a doctor or pharmacist for more information about the use of this medication. The recommended daily dosage and the optimal timing for taking this medication should also be discussed with a healthcare professional. Before taking Cyclobenzaprine Hcl Er, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Swallow the capsules whole and do not crush or chew them. If you have trouble swallowing the capsule, you can open it and sprinkle the contents on a tablespoon of applesauce. Swallow the mixture right away without chewing it, then rinse your mouth with water and swallow the rinse liquid to make sure you have taken all of the medication. Do not prepare the mixture ahead of time for later use as it may destroy the drug. The dosage of Cyclobenzaprine Hcl Er is based on your medical condition and response to treatment. It should only be used short-term, for 3 weeks or less, unless directed by your doctor. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition lasts after 2 to 3 weeks or gets worse, make sure to inform your doctor. If you experience drowsiness, dizziness, dry mouth, or tiredness, make sure to inform your doctor or pharmacist. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. However, be sure to notify your doctor immediately if you experience any serious side effects, such as fast or irregular heartbeat, or changes in mental or mood. Although rare, seek medical help right away if you notice any signs of a serious allergic reaction, like rash, swelling, severe dizziness, or trouble breathing. And if you notice any other effects not mentioned here, contact your doctor or pharmacist. As always, consult your healthcare provider for personalized guidance regarding the use of this medication. Before taking Cyclobenzaprine Hcl Er, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's important to also disclose your medical history, particularly if you have liver disease, overactive thyroid, heart problems, difficulty urinating, or glaucoma. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or engaging in activities that require alertness until you can do so safely. Additionally, it's advised to avoid alcoholic beverages and to consult with your doctor if you are using marijuana. If you have a surgery planned, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used if clearly needed, and it's important to discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so consult with your doctor before breastfeeding. It is important to be aware of potential drug interactions that may affect how this medication works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Cyclobenzaprine Hcl Er include tricyclic antidepressants. Avoid taking MAO inhibitors during treatment with this medication, as it may cause a serious and possibly fatal drug interaction. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. Ask your doctor when to start or stop taking this medication. Before using this medication, report the use of drugs that increase serotonin, including street drugs, St. John's wort, certain antidepressants, tramadol, among others. It is important to tell your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, other muscle relaxants, or antihistamines. Also, be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Ask your pharmacist about using those products safely. If someone has taken too much cyclobenzaprine Hcl Er and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of an overdose may include a fast or irregular heartbeat, fainting, severe drowsiness, trouble speaking, seizures, and changes in mental or mood, such as confusion or hallucinations. If you or someone you know is experiencing any of these symptoms, seek medical attention right away. It's important to remember that this medication is prescribed for your specific condition and should not be shared with others. Only use this medication for the condition it was prescribed for, and consult your doctor if you need to use it for a different condition. In that case, a different medication may be needed. If you forget to take a dose of cyclobenzaprine Hcl Er, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to store cyclobenzaprine Hcl Er at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.